Now we get to move on to the dreaded statistical analysis section. And I call it the dreaded statistical analysis section because I know that you guys dread it. Now, I am going to tell you that nobody expects you to be a biostatistician. Nobody expects you to know everything about biostats. Heck, I'm the person who likes Journal Club the most and likes looking at journal articles the most, and I don't even consider myself a good biostatistician. However, you do need to know enough information in order to interpret your statistical analysis sections. So the first thing I always look at in a statistical analysis section is power. So I always start this out with the question, what is power? Simply put, power means that there's the ability of a study to accurately detect an actual difference between treatment groups when such a difference truly exists. Or are there enough people to find a difference if a difference truly exists? So, the primary thing we use power for is to prevent false negatives. By false negatives, I mean that if we say that there's no difference between groups, when there really was one. So, for this reason, and just think about this for a minute, the time that power is most important, or it's going to have the biggest effect on your study, is whenever you don't find a difference. This may be event-driven versus a patient number. So what you're going to want to do is you're going to look and see if in the final analysis were the patients or events enough to meet power. So let me give you an example. This is a statistics section from a trial that I use a lot to talk about journal clubs. So what they targeted was 65 events of stroke or systemic embolism. This estimated incidence would be 5% per year of the placebo group and 15 milligram dose of endoxifen, resulting in a 50% lower risk reduction. So what this 50% lower risk reduction is in this section, that 50% is what you call the effect size. So prior to the trial, the statistical analysis or the statistician had to decide exactly what they think was approximately the percentages of difference between the two groups. I'll talk about effect size a little bit more in the next couple slides. Then you want to be that there would require to give the trial 80% power. So you do want power to always be greater than 80%. If it's 90%, that means that it's a little bit more strict. However, if it says that they only gave it like 75% power, that's an issue. And then, of course, you have your two-sided significance level of 0.05 or 5%. So what we want to look at, so now that we know that the power was set at 80%, the effect size was 50%, what we want to look at here is that if we had 65 events of stroke or systemic embolism. So you'll see here that this primary endpoint is stroke or systemic embolism. Hey, we've actually already learned about this. You took two different outcomes and put them together. This is a composite outcome. And if you guys are all playing along at home, this is a direct clinical outcome as well, because these are things that affect the way the patient feels, functions, or lives, or survives. But back to the idea. So what we're trying to figure out is if there were at least 65 events in the groups. If you'll look here, there was not. There was only a combined of 59 events in each group. So thus, this trial did not meet power. So let's talk a little bit more about effect size, or the example I always like to give for power. So, say you are doing a study, and what your hypothesis is that third graders, on average, are taller than first graders. So you start looking. You get one third grader, who's of average size, maybe one first grader of average size. Then you get a really, really tall first grader. These are my first graders, these are my third graders. Then a really short third grader. Then a really tall third grader. Then maybe a really, really tall, or a normal size, another normal size, need to work on my stick figures, another normal size first grader. As you guys can probably figure out, though we know that third graders are taller than first graders, when we're averaging all this together, it's going to take a lot of third graders and a lot of first graders to find that difference. This is what it means to have a small effect size. Meaning that we are assuming that this difference here may be just a couple inches. And for that reason, you're going to need more patients or more first graders and third graders. Versus if I change this trial to be, I'm going to compare 12th graders versus first graders. That's going to be a very different trial, because then I'm going to have, on average, every single 12th grader is going to be taller than probably the majority of first graders. Yes, you might have some outliers, like a very, very short 12th grader. But overall, you're going to notice pretty quickly that 12th graders are taller than first graders. Right? So this is a trial that has a large effect size. And would require a very small population. What I'm trying to get at here is that just because a trial has a very, very small difference between groups, or is assuming a very small difference between groups and needs a larger group of patients, it's not really a problem. You just have to remember that the smaller the effect size, the larger the population you need. So again, I always like to fill this out for you guys to talk a little bit about how we deal with power. So you'll see here at the top you have whether or not we met power or did not meet power. So whether or not we had enough patients or events. And then on this side we talk about whether or not we found a significant difference or we didn't find a significant difference. And we're just going to assume the normal p-value here of 0.05. So, and I'm sorry I say so often, when we're doing this, remember what I said. Power is a much bigger deal whenever we don't find a significant difference. Right? So, if I found a significant difference and I met power, that's okay. We're good here. Because we met power, so we're not at risk for type 1 error or type 2 error, and we found a significant difference. If we did not meet power and we don't find a significant difference, if we did not meet power and we found a significant difference, that's also not that bad of a deal. Because the whole function of power is to make sure that if there is a difference, we detect it. We found a difference. So again, power is not that big of a deal. Similarly, if we meet power and a significant difference is not found, it's okay because power did its job. AKA that there are enough patients in the population that we would have found a difference if there was a difference, and we just didn't find a difference. The only time power is a super big deal is if you don't meet power and you don't find a significant difference. This corner right here is your big bad corner, where you're at high risk for type 2 error. So if there's anything you need to remember from this discussion about power is, if you don't meet power and you don't find a significant difference, that's the big problem. The rest of these, it's okay. Again, I do not expect you to be a statistical analysis perfectionist here. I do want you guys to remember that there are several different types of data. You have nominal data, aka the yes-no. Was the patient male? Was the patient female? Those are yes-no questions. These is dichotomous. meaning that it only goes in 2 different ways. Yes, no. If it's ordinal data, and a good example of this is pain scores. This is where we can't assume that each number is equally distant from each other. So, example, again, being pain scores. If somebody has a pain score of 1 to 2, or 1, and it goes up to a 2, we cannot say that that's the exact same amount of pain difference as somebody who goes from a 2 to a 3, or a 3 to a 4. It has so many different interpatient variabilities. So it's less, you don't know that there's an equal distance between all points. And then continuous data. Continuous data would be data that lies on a spectrum that is equally distant from one another. This is also continuous variables, nominal data, parametric data is also known as continuous data, and non-parametric data is also known as nominal or ordinal data. And then another term you might hear that these both go by is non-continuous. The other thing you want to consider is how many patients are in each group. Each of these different tests are used in patients that are a different number of groups. That being said, this is not an all-inclusive list either. So it's always best practices as you're going through your data. First, identify what kind of data you're using, number of patient groups, and then look it up. Nobody expects you to be a biostatistician. When I'm evaluating statistics, this is what I look at. 1, was power met? And 2, was the statistic test appropriate? What is best is that there's power met and there are enough patients to say to meet power. If there are not enough people in this study to meet power, then we do want to make sure that if we don't meet power, that at least a significant difference was found. If not, then that's a limitation to your study. Was the statistical test used appropriate? Again, you just want to make sure that your statistical test is appropriate for the population and the patients and the number of patient groups, along with the type of outcome. Where you're going to find most of this is in the statistics section and the results section. If you do not have, or you don't have that power is listed anywhere in the manuscript, you can assume that it wasn't met.